1 teaspoon of concentrated botulinum toxin could humble a large city. However, in dilute concentrations, this toxin is producing many miracles of modern medicine. Muscular deformities of the eyes, speech dysfunction, and sweating disorders are a few applications of Botox. However, treatment of animation wrinkles and furrows of the face is the new frontier in the battle against aging. In competent hands, Botox is extremely safe and effective for frown lines, crow's feet, and forehead wrinkles. How does Botox work? How long does it last? And why? When your brain sends an electrochemical signal to frown, a molecule called acetylcholine is released through the nerve ending to trigger the muscle to contract. Acetylcholine is produced in the mitochondria and released into the cytoplasm in little vesicles with 2 chemical arms. There are 3 molecules in the nerve ending called snare proteins that have to combine in a process called docking. That opens a hole in the cell membrane, allowing the acetylcholine to pass through and stimulate muscle receptors to contract. SNAP25 is one of those 3 snare protein molecules. Botox molecules consist of a heavy chain and a light chain. The heavy chain attaches to a nerve ending with the help of zinc. The molecule then passes through the membrane by a process called endocytosis. The light chain then breaks loose and cleaves a SNAP25 molecule. This prevents docking of the snare proteins. A hole in the membrane cannot occur, and the acetylcholine is trapped in the nerve ending. The muscle cannot contract. You cannot frown. During the 3 months of blockage, new nerve buds are stimulated. At about 3 months, they are about to mature. When the blocked mother nerve awakens, the baby nerves may recede. That is why permanent or longer-acting effects are unlikely. The concentration of Botox has nothing to do with duration of action. Any amount above and beyond that needed to block the SNAP25 molecules is simply wasted. In fact, excess molecules of Botox may travel cell to cell, accounting for reports of distant site effects. Botox comes in freeze-dried form with 100 units per bottle. We slowly dilute with 10 cc's of normal saline. This results in a concentration of 10 units of Botox in 1 cc of normal saline. Therefore, a 1 cc tuberculin syringe contains 10 units of Botox. On the initial visit, 10 units of Botox is injected into the frown line muscles. The location of the injections depends on the muscle location and action, which varies with individual patients. Most physicians inject directly down among the wrinkles, but experienced surgeons find it comfortable to inject along the muscle belly. Complete paralysis of the frown muscles has no detrimental effects, and 10 units of Botox appears to do the job well. It takes about 1 week for the Botox to take effect after injection. Forehead wrinkles and crow's feet should be treated more conservatively. It is not desirable to completely paralyze these areas unless you wish to obtain the expression of a bowling ball. Initially, It is wise to inject 5 units of Botox into each of these areas. The objective is to weaken but not totally paralyze these muscles. This can be evaluated about 1 week after injection. At that time, the results can be appreciated and more or less Botox can be administered during the second treatment 3 to 4 months later. Botox is also safe and effective in the treatment of excessive axillary sweating. The dilute toxin is injected into the glandular area of the axilla, spaced about 2 centimeters apart. A special adjustable needle may be used to deliver the Botox just beneath the skin. The duration of action in preventing sweating is usually well over 6 months.